This is Afrometrics, research-based news, just giving you an update on the major research publications of this past week that are relevant to the Black world. So, what's new in the world of research on Black populations this past week? This week, a new study written by Natalie Watson Singleton, Jordan Pennefather, and Teresa Trusty was published in the Journal of Current Psychology. And the study was about the effectiveness of a culturally responsive mobile health application. The app was designed to reduce African-American stress because African-Americans experience a number of stress-related health conditions, as well as barriers to healthcare services. Some people have argued that culturally responsive approaches to mobile health, or what's known as mHealth, could be used to increase access to health skills that can reduce stress and improve well-being among African-Americans. The authors of this study conducted an experiment by testing the effectiveness of a culturally responsive mindful health application on the stress levels, the self-efficacy levels, and the mindful practices of a sample of 39 African Americans. And to do this, they created an app, and the name of the app was called Mindful You. The African American participants in the study received regular reminders to promote engagement with the app, and they received emails with health mindfulness messages. They received push notifications of up to 3 inspirational health messages on their mobile devices. And participants who gave valid phone numbers received 3 text messages with links to specific meditations to practice. The results showed that compared to their attitudes and practices before the app, after 2 weeks with the app, they engaged in more mindfulness practices, which means that they engaged in more careful thought about how they process their emotions, their thoughts, and their sensations. They also showed less difficulty regulating their emotions. They show greater levels of self-efficacy, which is self-confidence in their ability to use the lessons that they learned from the app to improve their well-being and their health, and they reported lower levels of stress. The study presents evidence for the potential use of culturally responsive mHealth apps to reduce stress in African Americans. This past week, a new study was published in the Sociological Forum journal this week, and it was called Black Ballerinas, the Management of Emotional and Aesthetic Labor. The author was Sakani Robinson. And Sakani Robinson explains that ballet is a predominantly white profession. She goes on to explain that American ballet was highly influenced by Black culture, which was and continues to be stolen and appropriated by white Americans, while Black bodies remain devalued and excluded. George Balanchine, one of the pioneers of American ballet in the mid-1930s, according to Robinson, was heavily influenced by Black culture, but supported strict embodied forms of aesthetic labor for women that came to characterize the ballerina, or the popular idea of the ballerina in the mind as a prepubescent, pure, and elegant. And this image worked in ways that further excluded Black women from ballet. As Robinson states, alongside this historical controlling images of Black women as curvaceous, sexualized, and impure worked to systematically exclude Black women from ballet. And the experiences of Black women in classical ballet have been neglected and under-researched in sociological literature on work and occupational inequalities, discrimination, embodiment, as well as emotions. To address this limitation, the author, Robinson, interviews 15 Black women ballet dancers who were employed by major US-based ballet companies. The participants were between 18 and 85 years of age. The purpose of the interviews was to better understand the experiences of Black women in ballet in context. It specifically examines the ways that Black dancers negotiate 2 forms of labor that have typically been understood separately: emotional and aesthetic labor. Emotional labor is defined as the management of feeling to create an acceptable, publicly observable facial and bodily display, and also managing feelings increasingly required in certain occupations. But what is aesthetic labor? Aesthetic labor is more about embodiment, the physical body. It refers to the management of the appearance or performance of a person's physical body. For example, aesthetic labor might involve things like weight management, shape, and posture to keep up appearances in an occupation. For example, being a ballerina. So one of the author's findings was the unique forms of discrimination and marginalization the dancers face because, for example, they experience rejection as dancers, including not being able to find proper clothing, tights, pointed shoes, leotards that match their skin tone. As a consequence, each invested more labor in altering clothing they could find to conform to the white norm dress code and making it work for their Black bodies. And this labor came at a cost involving time, involving energy, including dyeing their tights and leotards and coloring shoes and makeup, additional financial burdens, emotional costs associated with confronting the question of why these required tools of the trade were not made with their bodies in mind. The authors also found that the dancers faced issues related to controlling images of Black women, shaping their experiences. Stereotypical images of Black women exist through the roles that are given to Black women dancers and their efforts to avoid being depicted in ballet as mammies, matriarchs, welfare recipients, and Jezebels or video vixens. For example, within this study alone, 60% of the women that were interviewed were specifically assigned the role of the Arabian princess in the Nutcracker ballet. In the ballet, the Arabian princess is portrayed as exotic and erotic, wearing a bralette and the only dancer bearing midriff, while also requiring her to move her body in sensual ways around the male dancer with whom she is partnered, which is consistent with the stereotype of the Black Jezebel. And according to Robinson, the experiences of the Black women in this study demonstrate the utility of understanding relationships between emotional and aesthetic labor and making sense of the intersecting forms of inequality these intertwining forms of labor often work to support. Robinson argues that it's important to recognize the inequality produced by aesthetic labor demands in workplaces while also recognizing the emotional labor necessarily connected with these workplace demands. This past week, a new study was published by researchers at Pan-African University. According to the researchers, the study aimed to assess the public knowledge, risk perception, and preparedness to respond to COVID-19 in the early stage of the outbreak in Ghana, West Africa. The cross-sectional study was conducted to collect information from Ghanaians during the early stage of the outbreak from the 12th to the 20th of March, 2020. An electronic-based questionnaire was developed to collect information on the public knowledge, risk perception, and preparedness to respond to COVID-19. All people who were aged 18 years and over were invited to participate in the study. A total of 350 participants were recruited into the analysis. 56% were males, with a majority of the study population between the ages of 18 and 30. The majority were single, and the majority had attained a tertiary level of education. Regarding COVID-19, 62% had good knowledge about the outbreak, 68% had high risk of contracting COVID-19 infection, and 81% had moderate preparedness and skill to prevent and control the disease. The internet was the major source of information about COVID-19, and knowledge of COVID-19 was significantly associated with factors such as education, employment, and health-related occupation, but only religion was associated with risk perception. Though overall public knowledge was good, disparity exists among the least educated population. There was high risk perceptions and moderate preparedness skill to respond to COVID-19 among the study population. The researchers recommended that educational campaigns be conducted through timely online updates on COVID-19, through van mobilization, and mass media broadcasting, which should target all groups, including those in rural communities. This study was very interesting because it demonstrates how COVID-19 awareness has to be increased differently depending from country to country. The methods that are going to be effective in a place like Ghana will be different from the methods that will be most effective in places like the UK or the United States, even though they share a great deal of commonality about awareness and preparedness. Similarly, the Milwaukee Courier published an article this past week about recent data from the 2020 Nielsen African American report, as well as the Kaiser Family Foundation report on COVID-19. The research found that 5% of African American grandparents live with their grandchildren, and 40% of those grandparents are the main caregivers for their children. So this study is about the existence of multiple generations in Black households, and Black and Latinx households have, even before COVID-19, been overrepresented in America among those households with more than one generation living under the same roof. This data also showed that 29% of African American households are more likely to have children under 18 compared to 27% of all US households, according to the report. This has important implications for health. So living in a multi-generational home has become increasingly common in the United States. 1 in 5 Americans currently live in a home with multiple generations. While this living arrangement has its benefits, such as financial support, accessible childcare, and shared meals, a multi-generational household can also be a double-edged sword during COVID-19, especially for Black families. Some Black multi-generational families not having access to separate facilities in their homes poses a challenge when trying to stay healthy during a pandemic. Another concern facing African Americans are social determinants of health, which include access to quality health care, housing, transportation, and access to education and job opportunities. When it comes to employment, Black people are disproportionately represented in the area of essential workers, which not only increases our risk for contracting COVID-19, but also those who are living in their households. Thank you, everybody. This has been an Afrometrics research-based news brief, and you can visit us at afrometrics.org. See you all next week. Thank you very much.